In your morning medical news, today marks 5 years since COVID-19 was declared a pandemic. The World Health Organization made that designation after determining the outbreak was an international public health emergency. The previous pandemic was 2009's H1N1 flu, which killed hundreds of thousands globally. According to the CDC, nearly 1.2 million Americans have died from COVID-19. And on this pandemic anniversary, the federal government has stopped accepting orders for free at-home COVID tests. Health officials haven't explained why the program has been paused or if it's permanently shut down. Orders placed before 8 o'clock Sunday will still be shipped. At-home tests remain available at grocery stores and pharmacies for you to purchase. The FDA is moving to close a controversial food safety loophole. The generally recognized as safe or GRAS rule has long allowed manufacturers to add certain food additives without regulatory approval. Critics argue the current system enables companies to introduce ingredients with minimal oversight. The proposed changes aim to increase transparency in the nation's food supply. A new type of therapy is helping chemotherapy patients save their hair by freezing their scalps. Elizabeth Shores has more on the new treatment.
So this is to make it so it doesn't freeze to my head.
When Debbie Baca first started discussing chemotherapy with her doctors, a nurse told her about a new therapy that could help save her hair.
The goal is to have it where people see you and not your sickness.
It's just freezing and feels like you have like an ice pack on your head all around it.
Debbie says since she has a teenage daughter and works with kids and teens, maintaining some semblance of normalcy felt important to her. And the Paxman machine seemed promising.
We're talking with kids who might have big things they've already gone through, and I didn't want to be part of their trauma.
And that normalcy isn't just for their benefit.
For me, it also makes it so that I don't look in the mirror and have like a panic that I'm going through this, you know? So it gives me like a little more peace just seeing myself normal, because I've heard other people, because I haven't experienced it before of losing my hair. I just hear other people that they have trouble like looking in the mirror and seeing themselves without hair.
They'll just pop their token on here and then it kind of wakes up the machine.
RN Trisha James says patients put on a cooling cap followed by another cap, which freezes the hair follicle cells in the wearer's scalp. She says that helps prevent the hair fallout people usually experience when undergoing chemo.
Our patients that are currently using the machine have been happy so far with the results, and just like that they're actively doing something to help during this whole process. They're trying something to save a bit of normalcy in their lives.
She says there will still be hair fallout. For some people, it can be as much as 50%. But she says undergoing the treatment significantly boosts hair regrowth speed after chemo. Treatment sessions last for several hours. Debbie has her husband with her to keep her company, and they're making their way through quite a few videos while they wait. They'll be back again in about 2 weeks.